Today, the Michigan Department of Health and Human Services announced the state is leading the country in decreasing overdose deaths.
But in Kent County, those numbers have decreased even more. 13 News Science Jeremiah Brown joins us now in the newsroom with what is behind this positive development. Jeremiah.
Yeah, Julia and Elena, official numbers from the state show that overdose deaths in Michigan have gone down 5 times faster than the national average. Here in Kent County, officials say they have seen a 15% decrease over the past year, and that making resources more accessible has been key.
We've really been leading the nation in terms of targeted interventions, really putting products out there that will save lives.
After seeing overdose deaths increase nationwide during the pandemic, Michigan's chief medical officer, Dr. Natasha Bagdasarian, says the state leads the charge in seeing a dramatic reversal. Between 2022 and 2023, Michigan saw a 5.7% drop in overdose deaths, which is 5 times faster than the national average.
Preliminary 2024 data looks like we may be going back to rates that haven't been this good since 2015.
Dr. Bagdasarian says Michigan leads in increasing recovery treatment and getting naloxone, medicine that reverses an opioid overdose, in the hands of the community.
Since 2020, we've distributed about 1 million naloxone kits. The number of kits we distribute every year increases every year. So every year we're putting out more and more of those reversal kits. This year alone, in 2024 alone, we've put out over 320,000.
Here in Kent County, the decrease in overdose deaths has been even greater.
Between 2022 and 2023, we saw a 15% decrease in the number of overdose deaths, and actually an almost 30% decrease in the number of opioid-involved deaths.
But the county is also seeing another trend noticed across the state, which is disparities among different populations.
We've seen that there are equal rates of drug use among race and ethnicity groups. So that would lead us to believe that the experiences in overdose and in substance use disorder should also be equal across race and ethnicity groups, but we're not seeing that. And so that means that there's some kind of systemic or structural issue that's going on that's leading to greater numbers of overdose deaths in our Black population versus our white population.
The county is working with local Black-led organizations to continue addressing this disparity as health officials across the state keep their foot on the gas.
We're going to follow this data. We will see which programs have been most effective and then use the funding to really serve the interests of Michigan residents and meet people where they are.
You can find links to free Narcan locations across Kent and surrounding counties in the story online. In the newsroom, Jeremiah Brown, 13 on your side.